Hello and welcome to the Week 3 wrap-up. This is your instructor, Carissa Dolke. So in Week 3, we had a really exciting week. We got to discuss depression. So you really got to focus on different types of depression and how they should be treated. Should we use medication? Is there considerations for using medication? When should psychotherapy be added? And I discussed this a little bit in my last wrap-up for Week 2 and for the live lecture as well. Depression is something, it affects about 1 in every 10 to 11 individuals. So the average rate of depression diagnosis is about 10% of the population. This is according to the World Health Organization. This is a pretty big portion of the population, and they have found that even more instances of depression occur. They're underdiagnosed because patients usually can, if they're an exogenous form of depression or reactive depression, typically patients can use some type of self-therapy to help alleviate the symptoms and ultimately help treat the depression. But it's very important to understand how medications come into play when it comes to dealing with depression. Medications are used many times because there is a chemical imbalance that cannot be treated with psychotherapy alone. So medications have to be induced. Now, in Week 3, in the live lecture, we talked about the different types of antidepressants that are used, the anxiolytics and the antipsychotics. And usually, depending on the type of depression, there can be a combination of medications used. Not just one medication is always the best fit for patients. So for instance, if a patient has depression, but they also have anxiety, you'll see an antidepressant prescribed along with an anti-anxiety or an anxiolytic medication. Antipsychotics are also being added to antidepressant therapies because they do find that medications like Abilify will actually help increase the response of the patient to the antidepressant, so it actually makes it more effective. Now, there is an age restriction. I did post a study in one of my responses that found that children actually didn't respond very well to antidepressants. There was only one, fluoxetine, which is generic Prozac, that they responded to during a study. And so they were finding that antidepressants in children may not be the most effective treatment. And we usually see this. Antidepressants aren't used very commonly in children because there is such a risk of things like suicidal tendencies. It's very hard to get the dosage adjusted to be just right because their systems do respond a little bit differently to things like SSRIs. TCAs especially you won't see typically used in children. MAOIs you won't see used in children. So hopefully you got a lot of that discussion. Hopefully you better understand treatments involved and when treatments are typically used. And I want to thank you guys who shared experiences with depression and you kind of combine that with your research. Kudos to you on that. That is a great way to help everyone kind of understand depression and understand that it affects more people than we think. And there's a lot of different types of treatment options available for patients. Your assignment was your worksheet responses. So hopefully the worksheets helped you get through the readings. I know that having something there in front of you can make a big difference when you're actually reading through the material. So good work on the assignments for this week. The scores were really, really good. And I know you had a couple short answer responses, so good job on those. Remember, short answer responses should be in your own words using the textbook as a guide. No external sources on the short answer responses. The assessments were good too. The assessment scores, this is typical for this course because the assessments are critical thinking applications typically. They're a little bit more difficult in terms of responding because you can't necessarily find the response in your book. But overall, really good work on it. I'm really proud of you guys. You've worked really, really hard in this class, and it's definitely showing. And I can't thank you enough for being such awesome participants during these last 3 weeks. Now, in Week 4, we are moving on to endocrine system, kidneys. We're going to talk about all these different systems. We're going to talk about the use of steroids, glucocorticoids, mineralocorticoids. So it's going to be a really fun live lecture this week and really fun topics. It's not a cumulative final, meaning that it does not cover all of the material for the course. It just covers the Week 4 material, which is chapters 25, 28, 36, 38, and 39. This does close. So the final assessment closes at 11:59 p.m. Mountain Time Saturday. That means it will auto-submit. If you are in the middle of taking your assessment, it will auto-submit when the course closes. So give yourself plenty of time to take your assessment. There's not a worksheet for Week 4, but if you want to use your end of chapter questions, those can be an excellent source to help you. Or if you would like me to create a worksheet for you using your end of the chapter questions, I can. It just wouldn't be something you would submit for grade. So if you do want that, just feel free to email me or text me or call me. Just make sure you tell me who you are and what course you're in, and I can help prepare that for you. You also have a career integration quiz. Now, the career integration quiz is really for you to self-reflect on the course and kind of find what was most value to you. And this should be related more or less to content. It shouldn't be related to you being able to read the textbook, or it should be about the content. What did you gather most from the content? What is kind of those aha moments for you? What information did you not know before, and now you know, and that's just going to help you improve your role in healthcare. So I put an example down here. In this course, I learned about blank and blank. Until this course, I never knew blank and what an impact this has on. So for instance, we could even use week 3. So in this course, I learned about the use of antidepressants and the use of antipsychotics. Until this course, I never knew how many different antidepressants were available, that there are SSRIs, MAOIs, TCAs, and what an impact this has on healthcare and prescribing for treatment of depression. Now I understand that, and you could kind of summarize the different types of depression. You could talk about the different diagnoses associated with depression, how depression treatments are affected by the use of the medication, some side effects like anticholinergic effects, which I can use to help better understand my role as blank. So what role could you use this for? And that really helps you self-reflect on the course. I do this in my courses. I just finished my last course for my master's. I had my final for it. And after the course, I have to sit back and I have to look and say, okay, what did I gather from that course? What was the most value for me? And there was actually a couple different sections that were just awesome information that I never knew before, especially when it came to the reproductive cycle with actually focusing on hormone levels and talking about how hormones negatively feedback each other, but at the actual concentration. So what blood concentrations are we looking at? What, how is the actual corpus luteum function? How does it actually cause feedback mechanisms to occur for hormone production? So things like that. So I self-reflect. So this is a great practice for you, but make sure you're meeting the expectation of at least about 50 words, which is at least 3 sentences. It's pretty easy to get that if you focus on content. And make sure, if you have negative comments, make sure those are emailed to me. If there's things that you were questioning about the course or anything, feel free to email me that, but those are not accepted in the course reflection because the career integration is considered a course reflection, so it is your time to actually be able to reflect on the material. So if you have any questions at all, let me know. But I hope you guys have fun in this final week of the course, and I hope you've learned a lot, and there's a lot of takeaway knowledge that you can have. But I'm still here, so if you need it, if you have any questions or if you need anything, just let me know.